Hey guys, so I did my PSLO on the refusal of life-sustaining treatment based on religious beliefs. So the objectives of this is basically just to equip ER nurses with just knowledge and tools that they can utilize to navigate some more difficult situations when it comes to just situations that they might encounter where somebody is held back from treatment based on religious or like cultural belief or faith that they might have. So there's going to be a little bit about just special considerations and also just some of like the legal stuff that you can take a look at. And then we're going to get into the social justice of it as well. So um, this can be a very significant thing for a lot of people. There have been a lot of people throughout history that have opted out of even life-saving procedures based on what they believe. And those things need to be taken into account. Those things need to be considered. And so, um, there's some stories that I read about, there was a woman who she she wanted to refuse a blood infusion based on her religious beliefs, and the doctors had to call in a legal team in order to navigate that properly. So there's a degree of empathy that needs to be considered. It's easy, I think, as healthcare professionals to say, no, this is what you need to do, but that's not always the case. That's not always the right course of action. So we're going to help navigate that, hopefully, through this presentation. Some things that we need to just figure out are like why are some of the reasons why somebody might refuse something. This can be personal values, beliefs, or quality of life considerations. For instance, somebody going through cancer treatment might opt out for cancer treatment based on their quality of life, based on what they believe about life and how it should be lived out. And they might choose to live out the rest of their life in comfort and just let the cancer take its course and just spend that time with their families and loved ones instead of opting for further treatment. So, example, there's just more on like religious beliefs and things like that. Um, this is just like some examples and some things to think about. So here's more example specific ones. Patient from a conservative religious background firmly believes in the sanctity of life. They might uh, maybe in the context of like abortion, they might opt out to have an abortion, even if it would be a life-saving procedure for them because they believe so much in the sanctity of life. That's one possible example. Um, some of the things that we might run into are like inviting religious figures, chaplains and shamans and people like that into the healthcare setting to perform procedures that might advocate for that patient and their beliefs. And those might interfere with healthcare as well, but it needs to be taken into account that we need to advocate for that patient and their desires and their needs. So some of the things that can oppose or that can rise as challenges for healthcare workers are personal bias. You may feel a certain way about somebody's lifestyle or faith, and that needs to be challenged in your own life. That needs to be taken into account. How much of my own personal belief and opinion is being interjected into this situation? Language is another big thing. There are interpreters and people available, but it doesn't always translate the best way when you're conveying information through a third party. And then there's time constraints. Sometimes we don't have the time to talk about this stuff, especially in the emergency department, especially in emergency situations. There are certain things that have to be done very quickly, and it's not always available. The time is not always available to sit and chat things out. So those are some challenges that can arise. These are some legal concerns. There's some resources here that can kind of give you a good idea of some like real life situations that kind of goes back to what we were talking about a little just a minute ago. That woman with the blood transfusion, she verbally said she didn't want it, and then shortly afterwards she passed out. And so the doctor had to consult a legal team as to what the ramifications of providing that treatment were, because she may not have been in sound mind when she verbalized that she didn't want to be resuscitated and treated. So some of the strategies that we can utilize to get this accomplished are just cultural competence. Just be aware of different belief systems and how they play out in people's lives. Be aware of the vast difference of opinions and faiths out there. And just be respectful, be super open and honest, and be willing to listen and utilize the opinions of the patient and the client and their families in making decisions, and then advocate for those as well. So some good things to consider when communicating would be cultural and spiritual assessment. Again, be pretty proficient in what these faiths might look like. Just be aware of them. Just go into it with a non-judgmental attitude. Ask open-ended questions to help you understand more about what's going on. Active listening and empathy, and then reflective listening. These the last two kind of go hand in hand. You active listen, and then you reflect on what you've heard and take that time to respond properly. So we get into social justice here a little bit. Um, this is why we're doing it, because it promotes equal access to healthcare and resources. It helps address potential disparities, and it supports principles of autonomy and patient-centered care. So we're really just trying to advocate for the patient and be there for them as somebody who's a representative of them, and not the hospital or the healthcare treatment. So these are just some possible disparities that can arise. Again, lack of cultural competence, we kind of touched on that a little bit. So these are just some more ways that we can challenge our biases. You have to engage in self-reflection. So, when your ship's over, just take a look at yourself and figure out what's going on. Um, and then actively seek out opportunities to learn more about these people and their beliefs. Promoting cultural humility, just go into it again with a humble attitude and a willingness to learn. These are some ways that we can ensure quality improvement in healthcare. The significance of this is that it helps identify areas of improvement, promotes consistency, and enables healthcare professionals to adapt and respond to patients. So that's why we would be striving for this, ensuring quality improvement in healthcare. Um, one of the one of the things that this really encompasses is just communication. One of the things that we can do is foster trust, and that'll really help create an open dialogue for people to feel safe communicating with their healthcare providers. This also allows us to communicate and influence their understanding, and it minimizes conflicts. So these are some ways that we can actually improve quality in the healthcare setting. So standardizing protocols is obviously a huge one. We learn a lot about that in our program. Evaluating those standards and protocols is another big one. And then collaborating and engaging in the process of developing are also huge deals when creating these quality improvement processes. And this is how us as individuals, healthcare workers, can be part of that process. Just stay informed. Check on your bulletin boards. Make sure that you're up to date on policies, and join a union and an organization that helps collect resources. So that you have a voice when it comes time to advocate. So that's kind of what we've covered in this, just religious beliefs and why they have an impact on what we do. Um, some ways to navigate those challenges and those disparities, and then really why we're doing this, advocating for social justice in healthcare. Quality improvement is a more specific way that we can advocate for those. And then just highlighting our role as nurses, just that's where we come in to all this. That's where we have have impact in what we're doing. So thanks for listening. These are some resources for you.